The following is a presentation prepared by ARIA Health's Information Technology Department and will cover the functionalities of the Orders Reconciliation Manager on discharge. This video is intended for all physicians, residents, and advanced practice professionals and takes approximately 10 minutes to view. The discharge pathway in Orders Reconciliation Manager is used for the reconciling of patients' outpatient meds, inpatient med orders with the medications the patient is to take home on discharge and to create prescriptions if needed. The provider is alerted that discharge orders reconciliation needs to occur by a green flag on their patient list in the orders rec column once a discharge order has been submitted. The flag will turn red in 1 hour to alert the provider that the reconciliation has not been completed. On submission of a discharge orders reconciliation as complete, the flag will disappear. Orders Reconciliation Manager can be accessed in 3 ways: by double-clicking on the flag in the Orders Rec column, or by selecting the icon in your discharge instructions note. This will be located under your medication section. Or by selecting the Orders Reconciliation icon from the main toolbar. Discharge orders reconciliation can be started even if a discharge is still pending and then saved as incomplete. Orders reconciliation should be reviewed, updated, and saved as complete upon the actual day of discharge by the discharging provider prior to the patient's departure. On opening the window, the inpatient and home medications display on the left panel, and each medication will be labeled as either home or inpatient. Completed and discontinued meds within the last 24 hours will also pull in and display crossed out on this left panel. Let's review the toolbar. The medication default is displaying by therapeutic category. The group sort icon would allow the user to change this to sort by name. Under the format icon, you can expand or combine medications. Expand lays out the home and inpatient medication on a separate line, along with quick inline icon shortcuts. In the combined format, the home med and inpatient med are listed on one line. The inline icons are not available in this view, and you must use an Actions menu accessed by a right-click or a drop-down arrow. We'll return to the Expand form. Also under Format is to show best matching medications. On inpatient meds, it will display a converted active inpatient order to home med. Suggest to use will display if there is no exact home medication match. There will be an orange arrow and a form will open for the user to complete. Reconciliation details. Reconciliation type would allow you to switch to the admission reconciliation. Enter discharge order opens to an order entry worksheet. Order entry requested by, not currently being used here at ARIA. Enter home medication. Enter prescription takes the user to the prescription writer. Outpatient medication review, if you needed to view the verification of the home med list. Mark all remaining as discontinued on discharge works as a batch reconciliation for all meds not already reconciled. This will be demonstrated shortly. More actions Clear all reconciliations will remove the reconciliation and the home medication, but will not remove any prescriptions created. Check for new items would check for any newly entered medication orders. Discharge instructions opens exit care for patient education. Orders reconciliation requires a line-by-line review. Providers and consultants who would not be completing the reconciliation should enter prescriptions via the prescription writer and print their scripts from there. Medications entered as a prescription will appear with an RX home label. Right-click and select Show History to see the date and provider who entered this prescription. These additionally added prescriptions will appear for the discharging provider to perform a final reconciliation by selecting Continue as Existing Prescription. The next inline icon is to create a new prescription. Prescription Writer opens, and the days and/or quantity fields need to be filled. The Mark as Not Required icon will satisfy the reconciliation without creating a home medication. This will not discontinue the inpatient order. Another option is to leave all not required medications until you are finished creating the home medication list. Right-click or use the Actions menu for additional options. Replace with New Prescription will show additional doses or options. Replace with New Home Medication also shows additional doses and options, but does not create a prescription. Patient's choice will be an option on certain medications. Reconcile with existing items shows the current home medication list. Clear reconciliation will remove this med reconciliation. When finished creating the home medications and prescriptions, you can mark the remaining medications as discontinued on discharge by using the icon on the main toolbar. This will satisfy the reconciliation. There is also an action menu in any of the home medication fields. Upon completion of the reconciliation, you will need to save it as either incomplete or complete. Incomplete will save the prescriptions as unsubmitted to be printed on completion. Saving as complete will display the prescription dialog box. Cancel gives you options of yes to save the reconciliation as incomplete. No will cancel the reconciliation and remove all the home medications. And cancel will close this window. You can view information about reconciliations or change a reconciliation status by selecting the View Maintain tab in the Orders Reconciliation Manager. Notice the status here is Update Pending. This is because a provider discontinued a home medication after the discharge reconciliation was completed. This is the Update Pending icon, indicating this medication needs to be verified. Select Verify Updates to complete this reconciliation. Let's go back to the View History tab. Options on this toolbar here include to show the reconciliation document, Show History will display the creator, date, and status. Set to Pending indicates new medication information has been added and requires additional reconciliation. Set to Incomplete would allow the user to make additional changes to the reconciliation. Mark as Not Done is currently inactive. Entered in error does not discontinue the home meds or discontinue orders entered. Close when finished. This concludes the video on the discharge orders reconciliation. For additional information on this or the admission reconciliation, please refer to the orders reconciliation handout on ARIA Health's intranet site under Sunrise Acute Care, or call the help desk at 24026.